In this episode, you're going to see a mom named Virginia who came to see us and literally had a ramp built in her bathroom because she thought she was going to be in a wheelchair. We were able to help her so much that she got her very, very skeptical daughter to come in, and we were able to help her daughter. So incredible results. I think you're going to love watching it. So stay tuned. Okay, so I'm so happy to have Virginia Benoit with us today and her daughter Cassie Leger. And today we're just going to talk about an experience. Okay, the experience. I have my Dr. Scrubs on today, but we're going to basically I'm going to be like a regular layperson today, and I just want you to give your experience about all of your health conditions. You obviously have been here as patients, but you have a life that existed before coming here. Right. And then almost like a life that exists now after. So right. Could you maybe tell me a little bit? We'll start with you, Virginia, because you came to see us first.
Right.
And then convinced your daughter to come. So, and we can talk about that in a little bit.
So,
but maybe talk about your story as to
how I got here.
Yeah. Well, even before that, like talk about like the health conditions that kind of the experience, and maybe you don't have to go back to being a baby, but
no, about 5 years ago though, that's when I started getting the lower back pain and the leg pain, and I went to the doctor for it, and he gave me pain pills, and it was called gabapentin, and he gave me one a day, and it didn't work. So he said increase it to 2 a day, and it didn't work. And so he said increase it to 3 a day. And then I felt like lethargic. So I said, I don't want to be on these pills. And he said, we could try physical therapy. And I said, sure, I'll try anything for the lower back pain to go away. He did diagnose me with spinal stenosis, and I had 3 bulging discs in my lower back. So I went to physical therapy, and it did help some, but not much. So then we decided that I would do an injection in my back for the pain. And I ended up doing that, and it made the pain worse. So I told my husband, I said, I think I'm going to end up being in a wheelchair, because by that time, not only did I have leg pain, but my legs started becoming numb at the bottom, and my feet were numb at the bottom. So I said, I have to do something, so I guess I'll have to have surgery. So we saw a surgeon, and when we went to the appointment, he told me that he would not operate on me because I was overweight. So we left there with a little bit of sadness and not knowing where I was going to turn, what I was going to do. So this is the good part. I went home, sat in my chair, started scrolling Facebook, and I found the Nerve Health Institute with Dr. Cormier. And I'm like, God, are you giving me a sign? Is this my way out of this? And so what I did was the next day I called the office and made an appointment for the following week. And that's when I met you for the first time, the following week. And I still had the back pain, the foot numbness, and lower leg numbness. And so that's when I met you, and I was very impressed and to hear you. I was still a little apprehensive.
Sure.
But very impressed to hear what you had to say, watch you work.
Can I ask you, what is the apprehension? What was the and there's plenty of people watching this. Like, what were you skeptical about? Just so that they can kind of feel what you were feeling.
Because nothing ever worked before. Mm-hmm. So I thought, there's no hope.
Wow.
Yeah.
So you really almost just kind of gave up. You
about gave up.
You
and
didn't
I
know
said,
that
you were my last hope.
Yeah. We hear that a lot. So you thought that the healthcare kind of existed in a bubble.
Right.
And you had done everything you could do in the bubble, but maybe there was some other things you didn't know about.
Right. Absolutely not.
And
so when I came my second time and they explained me the program, I I said, Lord, uh, I surrender.
Hmm.
If it's your will, get me well.
Right.
Let Dr. Cormier use his expertise to get me well.
Amazing.
And that's where my journey started.
That's awesome. So before the back pain, remember the nerves in the back, right?
Mm-hmm.
They go down into the legs, but they also go to other parts. Did you have any other areas like um, those nerves go to like your ovaries and your digestive tract, and
Maybe
sometimes.
my digestive tract, and I
Mhm,
just didn't realize
mhm.
that, but probably so.
Gotcha. Okay, so have you ever seen a doctor that gets you results every single visit?
No. Um, my results came from getting that brain charged where I did not feel that I needed medication anymore. I was taking high blood pressure medication and antidepressants.
Wow.
And after a week or two in the program, I stopped it because I was feeling good. I was feeling joyful. I was feeling hopeful. And so I knew there was something more.
Hmm.
And so if you remember well, I started feeling so good about myself. I started eating healthy and I started losing weight.
So proud of you.
And I, well, in the last year and a half, I ended up losing almost 70 pounds.
Unreal.
And I still am not on any medication.
So just to clarify, we can't tell you to take or not take medication.
Oh,
So
right.
that was
Right.
up to you
That
and
was
your
up to me.
doctor.
I didn't need it.
But that's the beauty of the human body is when it's functioning higher, when the brain's better connected, you don't need those pills a lot of times
Right.
because once you're on one, chances are you're going to be on another and another and another. And big pharma wants you kind of going towards a 5-gallon bucket of pills in a nursing home, right?
Mm-hmm. Right.
But we're kind of the reverse, where we're keeping your body healing itself because
Right.
that's how it's designed.
And I felt it immediately.
One thing I didn't really talk about is we obviously have the Nerve Health Institute, and just so people out there are educated, when people come to see us nowadays, we have to go through a corrective plan to try to boost that nervous system up. So most people come to see us and they're in the 30s. I wish most people came to see us and they were 75%. But the fact is, most people come to us and that number gets lower and lower, and they develop more and more conditions. And so then we got to go through a corrective plan where we're teaching them all these things to do for home, which we're going to talk about. And also we're educating them on what to do for certain conditions at certain times. So we probably taught you all kinds of things, maybe even
Yes.
filmed on your phone, what to do based on your individual nerves that go weak and what to do. So we have Nerve Health Institute for that reason, but ultimately we want you to learn how to take care of yourself and need us less. That's my dream for people. So we've created BodyChargers, which is basically an at-home portal for helping people at home with all the different methods and technologies and techniques. So what about that experience? What about the home recommendations and what y'all have experienced there?
Well, the body chargers, I had wanted to talk more about that because Cassie would use the body chargers while she still didn't believe me.
And
I
just so we're
did.
referring for everybody
She would
watching.
use my body chargers that I bought. I was one of the first people to buy them because
Uh-huh.
you got them in January, and I bought it the first week of January.
Wow.
And yes, I bought all three,
Mm-hmm.
and I gave her one, the energy one,
Uh-huh.
and I took the Rhythm and the AP Mini, and I used it, and I still do use it almost 24 hours, 7 days a week.
Yep.
And I charge at one while I'm using the other one, and when that one needs charging, I switch them around, and I've been having them for 2 years now. That's when they came out. 2 years, and And like I said, I'm feeling great. I don't have any pain for 2 years. And if I do have something wrong with me, I'll just put it on that setting and it resolves.
Amazing. Yeah, so basically, she's referring to these. And y'all have seen these; they look like this, and basically, they're small devices that help reset frequency to cells, which is complicated, but it's like cells have their own tune, and so we're just tuning ourselves up. In today's day and age, there's so much interference; it's unbelievable the amount of interference that our body has to deal with on a day-to-day basis that can interfere with the health and the frequency in our cells. So literally, I was the first doctor to bring these to the United States from Europe. But they have 140 clinical studies, unbelievable stuff. And, companies like Big Pharma, they don't want you to know that you could put something in your pocket and reset some frequency to cells and your body feel better. But that's the nature of this. Now, in your case, in really both of your cases, it's advantageous to come here in addition to this because you get infinite amount of knowledge in addition to all the different techniques and treatments we do. So where would you say your health is, overall health? Where were you angled before? Where do you think you'd be if you hadn't come here? I guess is the question.
I would be in a wheelchair.
You think so?
Yes, I would.
Wow.
I would. Because I couldn't even grocery shop when I go to the store. Maybe I'd walk 2 aisles and I'd have to come back to the truck and have my husband finish doing the groceries.
Jeez.
And I would try to get in the truck. I had to bend over on the seat to kind of adjust my nerves, I guess, to get them relaxed for me enough to get in the truck. And or he would help me in the truck as if I was unable to use my feet and the bottom of my legs. So I definitely would be in a wheelchair.
Jeez.
She wasn't even walking.
I would not walk.
The past,
Yeah.
I think maybe the 2 weeks before you started coming here and seeing him. You
I
had
stayed in the
quit grocery
chair.
shopping.
Oh yeah, I couldn't grocery shop.
Yeah, she
I
couldn't
couldn't
grocery
go
shop.
anywhere. I couldn't. My quality of life was stopped. It was at a standstill.
So I find it interesting that you went to see a surgeon before us, and he wouldn't do surgery because you had to lose weight.
Right.
But ultimately, your nervous system needed a reboot. And that's what we did. So where you felt so much better that you could move around and do all that. And that's why all the weight came off, right?
Right.
So, and maybe even there were some side effects from some of the medications and you taking yourself off of that. And you can see this whole, I've witnessed in both of you, like these, you can watch people come back to life, like literally, where people are like you said, you were headed for a wheelchair, right? And all of a sudden you did the right things. You prayed about it and God sent you to the right place, got the right resources and somebody turned your cells back on and your body's healing. I mean, that's what it's about.
Absolutely. Yes, it was a great journey, and it continues to be a great journey. And it wasn't only the time that I had the leg pain and the feet numbness and the back pain, but I don't know if you're ready for me to say this,
Go
but
ahead.
we had there's a maintenance program where once you finish your program, you still come to the maintenance, you still come see you. And I come maybe every 1 or 2 months just to see and get recharged by you. And but in July, I fell and I slipped in my bathroom and I knocked my head against the toilet. And it was so hard that I broke the toilet seat with my head.
Jeez.
And my neck hurt and my whole body hurt. I had a headache. I couldn't even hear right. It affected my hearing. So my husband came and helped me, and I was just dazed. And I said, what do? I need to go and see if I have a concussion or something. And so I said, but I don't want to go to the emergency room. I hate emergency rooms. Most of us do. And so I said, oh, do you think Dr. Chris Cormier could help me? And so He said, try calling him. So I did, and they said, come in in the afternoon.
Yep.
I got over here. He had to drive me because I was out of it. And you and your team, your great team, assessed the situation, did what y'all had to do to get me better. I walked out of here joyfully with no headache, no pain, no neck ache, and I could hear well. And I looked at my husband and I said, I'm fine. It was a great feeling.
Those are called cranial nerves, and they're back here, and they're the most important nerves in the body. They make you hear, balance, swallow, talk, see, all these smell and taste. That's all cranial nerves back there. So a lot of times when people hit their head, they'll turn off like breakers in a breaker box.
That's what happened.
Some of those nerves, and you flip them back on. And your case there, we had already done a bunch of work on your nervous system. So that's where we want you. Your nervous system wasn't at 42%. It was stronger.
Right.
And so when you have a crazy injury like that with a stronger nervous system, you're less injured. Mm-hmm. But if you would have been at 42% and had that same fall, you might have died.
Oh, wow. Yes.
See how that works?
Wow.
And then you recover quicker. Once you start as a patient here, it's like your nerves remember the treatment. They remember the connections better when we start doing this sort of stuff. So if you ever have something like that, it's the cool. I can't tell you
awesome.
How many times we've seen, thousands. I've seen concussions and that type of, oh goodness. In football, my kids are athletes. I mean, I've so many on the field, unbelievable. And the kids, every time I fix one, the kids are like, how did that just happen? You know?
I mean, my husband was like, is that you coming out walking, smiling, happy? And you're not the same person that went in there. And just 45 minutes later.
Yep.
It was so nice not to have to go to an emergency room, and I could just come here.
Amazing.
See you.
If this podcast spoke to you, or if you feel like you have family members or friends that have these types of conditions that could benefit from this particular technology, then all you need to do is become a BodyChargers member or tell them about BodyChargers. Remember, it's our community that I created to help people at home with the best technologies in the world to be able to help you to self-heal your body at home and maximize your self-healing. So go to BodyChargers, become a member. That's the easiest way to get this done. And we look forward to serving you and your family. Also, if you want a higher level of care, we have the Nerve Health Institute you can always come to. That's our clinic where we have higher level services here to be able to help you. So I hope you enjoy, and we look forward to serving you and your family, and look forward to our next podcast.